It's indeed a proud privilege for me to come in front of the media guys. The media, it's always, I'm always scared to, come to the media and to even speak out because, so this is first kind of experience for me, and I revere this a lot because engaging media, I feel it's a very, very important thing for all our endeavors, particularly in times of this raging pandemic. And I will not take much time, maybe about 5-10 minutes. I'll just go through some of the slides which talks about media, which talks about stigma and how to what can be done to handle that. So stigma, you may all have heard about the term stigma. Actually, it is an attribute or behavior that socially discredits an individual by virtue of them being certified as undesirable others by the society. It is one of the famous social scientists, Dr. Irvin Goffman, had given this definition in 1963, and it still holds forth. That's the best definition we have. And of course, stigma is something which is associated with many, many medical illnesses for centuries together. So it is a question of segregating few from the others. It also leads to some sort of a labeling with some names or whatever it is. It is something associated with we versus they dichotomy. So the difference is there, and it of course leads to widespread discrimination that we all know. And of course, in this period of COVID pandemic, that is very, very clear. So when it comes to COVID-19 pandemic, I think it's one of the largest known outbreaks in the recent history of mankind. Of course, everybody knows that the Spanish flu occurred in 1918, so exactly 100 years ago, and it went on for 2 years, and we don't know how long this pandemic will go on. And recently, the count in India has crossed 1 million, and there are many containment measures, like, for example, isolation, quarantine, creation of containment zones, there is lockdown, there is seal down, there is dedicated hospitals related to COVID. All of these things have the potential to evoke stigma. Next. So, as Professor SKC was mentioning, it has actually created a parallel mental health pandemic. The panic and anxiety, depression, grief, it's actually pretty widespread. And the problem is that these mental health concerns are likely to remain even after the acute phase is over. Once the public health emergency is over, then the mental health consequences are likely to remain for far more greater periods in time. Also, because there is a lot of uncertainty about the future, and this infection is extremely, very, very contagious disease. And there are loss of jobs, routine migration, economic downturn. All these are very good recipes for stigma, prejudices against people. So, I mean, coming to stigma, it's a widespread phenomena that we have observed as regards this COVID-19 pandemic. Not only the race, I mean, the initial where it started in China, so that itself became a stigmatizing thing. And there is no place in this world which is not stigmatized by this current COVID pandemic. So, next slide, Ken. Yeah, so generally, when you talk about stigma, the targets are others. Now, who are these others? Anybody who is seem to be not from the same community, the state or country, etc. In the early part of pandemic, I think everyone knows that people of Asian descent were discriminated against. Stigma can be in the form of that what we have seen in this COVID-19 pandemic was in the form of verbal assaults, denigrating, social media campaigns were there. And later on, I mean, of course, practically everyone who was infected with this virus, and those were recovered too. And not to mention healthcare workers and other frontline warriors in the form of police and other agencies, they were also stigmatized and discriminated against. And certain communities and areas were labeled based on false reports and social media posts. So these are some of the dangers. And like to give you some examples, the Air India crew members who brought NRIs were not allowed to return to their homes. Doctors and healthcare workers were being denied were denied their entry into their apartment complexes. The stigma was present when homes got quarantine labels, burial rights were denied for dead individuals, and we have seen stories of families who have refused their own kith and kin. Governments had to bury them, and of course, survivors being isolated by neighborhood. Now, when you look at as to why this illness is so stigmatizing, this is what the WHO has given. I mean, what they say is that it is a fairly new disease. New disease in the sense the virus was not known before in humans. So the scientific information is still not much, and so always there is a fear of unknown things, and that can contribute to this kind of things. And it is easy to associate this fear with others. Whenever we don't have an answer, it's a psychological phenomena to attribute that unknown fear to others, and just label them or discriminate them. And it has created vicious cycle of panic, fear, of course, fueling stigma. So, what is the impact of stigma? If stigma is there, so what will stigma lead to? So, some of the things are, people fearing stigma, they can hide their disease. That's the most important phenomena. So, hiding, if you hide, I mean, you can't seek treatment in a timely fashion. And of course, it discourages people from adapting healthy practices. It causes social isolation, and it also undermines social cohesion. Social cohesion, of course, social distancing has to be maintained, but cohesion can be maintained, should be maintained in these times for better mental health of the population. So that itself can get undermined because of this stigma, which can finally lead to difficulty in controlling the disease. So. Going on to a few other things related to stigma, a sense of isolation and despair can be seen, depression, and a host of other anxiety-related symptoms or sometimes syndromes, deliberate self-harm, where day in and day out we are seeing the suicide rates could be raising. Some of the suicides can be related to these stigmatic factors. And of course, the suicide cases, the completed suicides also are raising, particularly in this part of the world. So after now, in the next few slides, we'll just talk about how to handle the stigma and what one can do with regards to tackling this particular stigma. One important and essential thing is to have complete proper understanding of whatever known information about the COVID is there. Like, important to understand and realize that it is highly contagious and it spreads very, very fast and can infect any one of us. And as of now, preventive measures are the only absolute essential thing to control this disease. And proper information about preventive measures, and not to fault and not anybody's fault to get into this kind of infection. Also, understanding that majority of those infected will recover from it, being careful about what news to be spread, take information only from authentic sources, cross-checking information before spreading the messages on social media, and sharing positive stories from recovered patients. And when you use terminology, that is very, very important. It's very essential to use a common terminology, which is why the WHO has thought COVID-19, coronavirus disease 2019, that is a desirable term. It is important to use this term globally, so a single term needs to be used. And of course, promotional campaigns and media advertisements, of course, Dr. Chaturvedi was talking about the infodemics. So that is happening very nicely, I would say. And to label, instead of COVID positive or a COVID case or a COVID patient, a person suffering from COVID, that would be more appealing, is what WHO says. Next 2 or 3 slides, the WHO has given some advertisements, so that those such kind of things can happen in more and more innovative ways. These can be translated to various languages, into various kinds of information, education, communication materials that has to be spread, far and wide. Next slide, madam. Next slide also. So these are some of the things which WHO has given, pretty nice ones. So some of the other things that can be done to tackle stigma is to engage survivors. Engaging in the sense, one needs to go and talk to them, what their experiences are, and those who have recovered, and ask them to share those experiences with others. lived experiences of patients, family members. That is also another thing to reduce the stigma, creating hope in the minds of public and avoiding sensationalizing. And coming to the next slide, use of social media. Social media can be a double-edged sword. It can, the information spreads like a wildfire, and so responsible use of social media is very, very essential. And engaging social influencers like movie stars, popular sports. This also, I feel, my personal opinion is that things are happening very nicely in this sphere, day in and day out. We keep listening to many messages like that. Being thoughtful and responsible while reporting in the media, spreading facts using simple languages, avoiding clinical terms is very essential. And of course, hero campaigns. The hero campaign is nothing but engaging the survivor. Then portraying stories of different communities, see to it that typeface symbols and formats are neutral and don't suggest, they don't point to any particular group. And defocusing on individual behaviors and the person's responsibilities for having and spreading COVID-19, promoting preventive strategies and correct misconceptions. So I think I have only one more slide. I would like to conclude by stating that stigma is as old as the disease itself, maybe is as old as the mankind itself, one can say, and does have deleterious effect both socially and medically, multifactorial in origin, and it's everyone's responsibility to tackle the same, which can be done very effectively. Thank you.